My name is Dr. Helson. I have practiced medicine for over 20 years. And in those 20 years, I have watched hundreds of patients walk into my office carrying a version of that same regret. Not because they were careless, not because they didn't love their health, but because nobody ever handed them this letter. Today, I am handing it to you. What you are about to read is not a medical lecture. It is not a list of symptoms from a brochure. It is something far more personal than that. It is a letter, written from the version of you that already knows what happens next to the version of you sitting right here, right now, who still has time to change it. Read carefully, because somewhere inside what I am about to share, you may recognize yourself. And that recognition could be the most important moment of your life. I remember when it started. I just didn't know that's what it was. I remember sitting in my favorite chair one evening and noticing something strange about my feet. A tingling, a quiet, buzzing sensation like static electricity running through my toes. I shook my foot. I crossed and uncrossed my legs. And then I told myself the same thing I imagine you're telling yourself right now. It's nothing. My foot just fell asleep. And I moved on. That was my first mistake. What I didn't know then, what I know now, is that tingling and numbness in the feet that keeps coming back without a clear reason is not your foot falling asleep. It has a medical name, peripheral neuropathy, and it is one of the earliest signs that blood sugar has been quietly elevated for longer than you realize. Here is how Dr. Helson explained it to me, far too late, when I finally sat across from him in his office. Think of your nerves like electrical wires running from your brain all the way down to your feet. Every wire has a protective coating around it. That coating is what allows signals to travel cleanly, so your brain knows exactly what your feet are feeling. When blood sugar stays elevated over time, it acts like a slow acid eating through that protective coating. The wire still functions for a while, but the signals start getting fuzzy, distorted, and that fuzz, that quiet static, is the tingling you feel. The American Diabetes Association confirms that peripheral neuropathy affects nearly 50% of people with diabetes, and it almost always begins in the feet, which means right now, tens of millions of people are feeling exactly what I felt and doing exactly what I did, shaking their foot and moving on. What I wish I had done then, started a 20 to 30-minute walk every single day. Not a run, just a walk. Movement keeps blood flowing to the feet and protects those nerve endings before the damage goes too deep. And I wish I had reduced added sugar that same day. Not next week. That day. Then came the nights. I remember lying in bed, the house completely quiet, and feeling like the soles of my feet were on fire. Not warmth. Fire. A burning so distracting it pulled me out of sleep and left me staring at the ceiling wondering what was happening. I told myself it was the summer heat. I told myself I had walked too much that day. I told myself a lot of things. What was actually happening was this. The nerves in my feet had already been damaged by excess sugar in my blood. And now, instead of going quiet, they were misfiring, sending false heat signals straight to my brain. My brain received a fire alarm, but there was no fire, just a damaged sensor screaming in the dark. Dr. Helson showed me research published in the journal Diabetes Care, confirming that burning foot pain is one of the first symptoms reported by patients later diagnosed with type 2 diabetes, often appearing 1 to 3 years before any formal diagnosis. 3 years. I had 3 years of warning, and I spent those years adjusting my blankets. What I wish I had done then. Drank at least 8 glasses of water daily to help my kidneys flush excess glucose, and added more fiber to every meal, vegetables, legumes, oats, because fiber slows sugar absorption into the bloodstream. Small habits. Enormous difference. This is the one that frightens me most to write about. I had a small blister, a tiny, insignificant blister on my heel from a new pair of shoes. I barely noticed it. I put a bandage on it and forgot about it. 3 weeks later, it was still there. I told myself it just needed more time. I told myself I was probably on my feet too much. I told myself it would close. What I didn't understand was that when blood sugar is consistently high, the body loses its ability to heal efficiently. The blood vessels throughout the body, including the tiny ones in the feet, narrow and stiffen. Oxygen, white blood cells, the nutrients that repair damaged tissue. They cannot reach the wound fast enough. So the wound just sits there, open, vulnerable, waiting. Dr. Helson used an analogy that has never left me. Imagine trying to water a garden with a hose that has a serious kink in it. The water exists. It just cannot get to where it needs to go. That is exactly what high blood sugar does to circulation in your feet. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Over 100,000 every single year. Almost every single one of them started as a small wound that someone decided to wait on. I was almost one of those 100,000. What I wish I had done then, after every bath or shower, sat down and examined both feet carefully. Every toe, every heel, any cut, blister, or broken skin cleaned immediately with mild soap, treated with antiseptic and covered. And if it hadn't improved in 48 hours, called the doctor. Not next week. 48 hours. I walked past it every single day, a darkening around my ankles, a reddish, sometimes bluish tint to the skin near my feet. I glanced at it occasionally and decided it was sun damage or just the natural color of aging skin. It had been there for over a year before anyone looked at it the right way. When circulation is compromised by high blood sugar, the lower legs and feet stop receiving enough fresh oxygenated blood. The skin responds. It darkens. It shifts toward deep red or even blue around the ankles. It becomes thinner, more fragile, because the tissue is slowly being starved of what it needs. Dr. Helson described it this way. Your blood is a delivery truck carrying oxygen and nutrients to every part of your body. Your feet sit at the very end of the longest delivery route. When the roads narrow from blood vessel damage, the deliveries stop arriving. The skin, receiving nothing, begins sending a distress signal you can see with your own eyes. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. 18 months. It was right there on my ankles, in plain sight. What I wish I had done then, 5 minutes of ankle circles, toe raises, and calf stretches every single morning. Even that small amount of movement pushes blood down into the feet. And when sitting for long periods, elevating my feet slightly. Such a small thing. Such an enormous missed opportunity. For 2 years, I put lotion on my heels every night. And every morning, the cracks were still there. Sometimes deeper. Sometimes bleeding slightly at the edges. I bought better lotion. Thicker creams. I tried everything on the shelf. Nothing worked. Because the problem was never the skin. Diabetes affects the autonomic nerves. The ones that control functions your body handles automatically without you ever thinking about them. One of those functions is regulating moisture in the skin. When those nerves are damaged, the sweat glands in the feet stop working properly. The skin loses its natural moisture from the inside out. No lotion on earth can fix a nerve that has stopped doing its job. Dr. Helson told me to think of my skin like a wall that needs mortar between the bricks to stay sealed. When the autonomic nerves are damaged, the mortar crumbles. Cracks form. And those cracks are not cosmetic problems. They are open doorways for bacteria and infection. In feet with already compromised circulation, that infection can escalate rapidly. The American Podiatric Medical Association identifies chronic, hard-to-treat heel cracking as a significant indicator of autonomic neuropathy, directly linked to long-term elevated blood sugar. 2 years. 2 years of lotion. And not once did I ask why it wasn't working. What I wish I had done then. Continued moisturizing every night, but understood it as symptom management, not a cure. And seeing a doctor the moment, I realized no product was making a real difference. That realization should have been my alarm. Instead, it became my routine. I need to stop here, because what I have shared with you so far, those first 5 signs, those are the memories of the version of me that waited too long. But there is another version of this letter, a version written by the me who caught it early, the me who saw sign number 3, the wound that wouldn't heal, and called the doctor that same week, the me whose blood sugar was caught at a manageable level, who changed his diet, started walking every morning, and today, years later, is still independent, still healthy, still doing everything he loves. That version of me also wants to write to you. And that version says only this: you are reading this at exactly the right moment. Don't put it down. Keep going. The next 4 signs are the ones most people never connect to blood sugar at all. They're the ones hiding in the most ordinary, overlooked corners of daily life. And they may already be present in your body right now. Keep reading. Please. The sock marks. I remember the sock marks. Every evening, I would take off my socks and find deep indentations around my ankles that took far too long to fade. I told myself I'd been on my feet all day. I told myself it was the heat. I told myself everyone my age dealt with some swelling. But this wasn't occasional. It was every single evening, without fail. What was happening was this: high blood sugar had been quietly damaging my kidneys for years. And the kidneys are responsible for controlling the body's fluid balance. When kidney function becomes impaired by chronic elevated glucose, fluid accumulates in the lowest part of the body. Gravity does the rest. It pulls in the feet and ankles. Dr. Helson pressed one finger gently into my swollen ankle and lifted it away. The indentation stayed. He called it pitting edema, and he told me it was not a foot problem. It was a kidney problem that the feet were reporting on behalf of the whole body. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity swelling is frequently the very first visible sign that kidney function is being compromised. 1 in 3. And I blamed my socks. What I wish I had done then: elevated my feet above heart level whenever resting, even just a few inches on a pillow. Reduced sodium dramatically, because salt causes the body to retain water, making edema significantly worse. And brought it to my doctor's attention the moment it became a daily pattern rather than an occasional occurrence. The pain came at night. Not a dull ache. A sharp, electric, stabbing sensation, like a hot needle being pushed through the sole of my foot. I would be completely still, lying in bed, and suddenly a jolt of pain so intense it made me flinch. I told myself it was arthritis. I told myself it was an old sports injury from decades ago, finally catching up with me. I bought ibuprofen in bulk. It dulled things slightly, enough for me to stop asking questions. That was one of my worst decisions. What Dr. Helson explained to me, after all those months of mass pain, was that when nerves are severely damaged by high blood sugar, they do not always go quiet. Sometimes they become overactive, hyperactive. They begin firing random, intense signals that the brain interprets as agonizing pain, even when nothing is physically wrong with the foot. He compared it to a car alarm damaged in a fender bender, going off randomly, screaming into the night for no real reason. The alarm is broken. The car is fine, but the noise is completely real. The pain I felt was completely real. Its source was not an injury. It was a nervous system sending distress signals that I had been chemically silencing for months instead of listening to. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is routinely mistaken for arthritis, tendinitis, or age-related joint pain. Routinely mistaken. I was routine. Well, I wish I had done then. 5 minutes of gentle foot and ankle stretching every morning before getting out of bed. Flexing the feet, circling the ankles, pulling the toes back softly to get blood moving before placing any weight on the feet. And a gentle 3-knot massage every night before sleep. Not ibuprofen. Never just ibuprofen. My wife used to joke about it. She called me the man with the iceberg feet. Even in summer, even under 3 blankets, my feet were always cold. We laughed about it for years. It was cold in July, cold in August, cold in a warm bath if I wasn't careful, cold in a way that had nothing to do with the temperature of the room. Dr. Helson was not laughing when I described it. Feet that remain persistently cold. Cold in summer, cold under heavy blankets, cold when the rest of the body feels warm. Indicate that warm blood is simply not reaching the extremities in sufficient volume. The blood vessels have narrowed or stiffened to the point where circulation to the feet is severely compromised. He described my blood vessels like heating pipes running through a house. When those pipes narrow from years of blood sugar damage, the heat never reaches the far end of the house. The room stays cold, not because the furnace isn't working, because the pipes can no longer carry what the furnace produces. The American Heart Association identifies peripheral artery disease, caused by narrowed blood vessels, as affecting over 8 million Americans, with diabetes being the single largest risk factor. Persistent cold feet are one of its earliest and most consistent warning signals. We had joked about it for years. It had been a warning for years. What I wish I had done then: a 30-minute brisk walk every single day. Arms swinging. Purposeful, not a stroll. A walk that forces blood into the lower legs and feet, strengthens vessel walls, and over time begins to reverse early narrowing. Even starting with just 10 minutes. The furnace was always working. I just needed to clear the pipes. This one I almost don't want to write about, because it is the hardest to admit. I never noticed it. Not once. Not in years of looking at my own legs every single day. It was Dr. Helson who pointed it out during a routine foot examination. He looked at my lower legs and the tops of my feet and said quietly, "When did you last notice hair growing here?" I looked down, and I realized there was almost none. I said what most patients say. "Huh, I never noticed that." He nodded. He had heard those exact words more times than he could count. Hair follicles require a steady, consistent supply of blood and oxygen to function. When circulation has been significantly impaired by long-standing elevated blood sugar, the follicles in the feet and lower legs slowly stop receiving what they need. Over time, they stop producing hair entirely. Not suddenly, gradually, quietly, in a way that is almost impossible to notice unless you are specifically looking for it. Dr. Helson described hair follicles like small plants in a garden. When the irrigation pipe narrows, the plants don't die overnight. They just gradually stop growing. The absence of growth is the message. A message written in something as simple and easy to see as the hair on your own legs. Research published in Diabetes, Obesity, and Metabolism confirmed that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. A reliable and frequently overlooked sign that physicians are specifically trained to examine. It was there the whole time. I just never had the eyes to see it. Well, I wish I had done then. Looked. Simply looked. Right after reading something exactly like this. Looked at my lower legs and the tops of my feet. And if the hair had been significantly thinner or absent, scheduled a blood glucose test that same week. Approximately $12 at any certified lab. Covered by Medicare for most people. $12. That is what this cost me to find out too late. You have just read 9 memories. 9 moments where I saw something, felt something, noticed something, and decided it was nothing. And I want to be honest with you about something that Dr. Helson said to me on the day I finally sat across from him with a diagnosis I had been carrying unknowingly for over 2 years. He didn't say, "I told you so." He didn't make me feel foolish. He looked at me and said quietly, "You're not unusual. You just didn't have the information. Most people don't." That sentence stayed with me. Because it is true, and it is also not an excuse anymore. Not for you. Not after today. You now have what I didn't have. You have the letter I wish someone had written for me before any of this began. So tonight, before you go to bed, I am asking you to do one single thing. Sit down. Take 30 seconds and look at your feet. Look at the skin. Check between the toes. Notice if there is any wound that has been slow to heal. Feel for numbness. Look at your lower legs and ask yourself honestly, when did you last see hair growing there? 30 seconds. That is all I am asking. And if you see or feel anything on this list, call your doctor tomorrow. Not next week. Tomorrow. Because the earlier this is caught, the more completely it can be managed. In most cases, through something as simple as a change in diet, a daily walk, and a single honest conversation with your doctor. You work for the life you have. Your independence. Your health. Your ability to move through the world on your own terms. Don't allow something as manageable as blood sugar to quietly take any of that from you, simply because no one handed you this letter in time. I'm handing it to you now. The only question that remains, is this. Which version of this letter will you be writing 5 years from now? The one filled with regret over the signs you ignored? Or the one filled with gratitude for the 30 seconds you took tonight? That choice belongs entirely to you, and it begins the moment this video ends. If this letter reached you, if even one sign made you pause and think, share this video right now on Facebook. Tag someone you love, a spouse, a parent, a neighbor, a friend who always says, "I'm fine." You may be giving them something they didn't know they needed. And if you want more conversations like this one, real medical information told in a way that actually reaches you, I post a new video every week on this channel. Subscribe and bring someone you love along with you. I'm Dr. Helson. Take care of those feet.